Okay, so I guess good morning, good afternoon, and good evening, everyone. Welcome to our day 2, at least for our special session. And before I begin, I would, as our practice here in Australia, I'm now in Melbourne at the moment. I would like to begin today's session by acknowledging the Wurundjeri people, who are the traditional custodians of the land on which I am zooming in today. And I would like to also pay my respects to their elders past, present, and emerging. And I would like to extend that respect to all Aboriginal and Torres Strait Islander peoples, as well as First Nations people who are attending this session today. Okay, so we have 3 presentations for today, for this afternoon or evening on my side. And we will be talking about different aspects, 3 contexts. So we have Dhaka, Jakarta, and Manila. So for our first presentation, we'll have Mehnaz. So Mehnaz will be talking about, the informal mitigation efforts, focusing on how Dhaka city learned to cope with COVID-19. And so there will be 2 parts to her presentation, and Mehnaz would be exploring more about those 2 aspects. And before I call on Mehnaz, I would like to introduce her. So our first presentation is from Mehnaz Rabbani. And so Mehnaz is from Bangladesh, and joined BRAC, Institute of Governance and Development in BRAC University in 2019. She's lead research for policy and governance. She is currently working as head operations and strategic engagement and partnership with an economics as the base, as her background or training. And Mehnaz has worked both as a researcher and a practitioner for over 15 years. So this presentation that Mehnaz will be sharing with us was based on her research in collaboration with Shamail Ahmed. So without further ado, I'd like to call on Mehnaz to start her presentation.
Okay. Great, thank you. Thank you, Darly, and thank you for this opportunity to present this work, which is work in progress. So in this paper, we worked with Shamail Ahmed, who is a research associate at BIGT. She's also here, I believe. So we look at the informal mechanisms of coping with COVID in Dhaka city, often in comparison with the formal mechanisms as well, to understand what really worked for Dhaka, for the residents of Dhaka. So just briefly, as an outline, in this paper we use, it's based on secondary data. So we did a synthesis of research looking at the effect of COVID on the informal sector. So one caveat is if there are parts of the society where we didn't find research on or evidence on, we can't say much on that. So it's a synthesis of only available research on sectors that were available. So that's a caveat. So there's a lot of, I'm sure, important parts that are missing from the study. And then we sort of delve into 3 cases that we worked on to understand what really worked for us in Dhaka. And a lot of the research that I refer to, or the results that I drawn, were done by BIGD itself, so our research teams, and some of them are from outside BIGD as well. So just briefly looking at the timeline of COVID, the onset of COVID-19 in Bangladesh. On the 26th of March, actually, so we knew about COVID from January, December earlier, but actually the first case of COVID was detected in March. So from the 26th of March, there was a week-long general holiday announced in Bangladesh, with some exceptions. The exceptions were basically export-oriented garments factories. So everything was closed except for factories that were exporting garments, because that's an important part of our economy. And what happened at that time, people were not really sure of what's happening, and it was called a general holiday. It wasn't called a lockdown. So a lot of people thought that it was like a holiday. So there was a huge rush to get out of Dhaka. People, especially in the informal sector, people working here are migrants from rural areas. So there was a huge rush going out of Dhaka. So a lot of people left the city. And then slowly the pandemic unfolded and people started to understand, okay, this is serious business. In April, there was an extension of the holiday. And a lot of the informal workers, obviously vendors, street vendors, domestic workers, rickshaw pullers, they were all forced to move back to rural areas or stay back and figure out how to live. And then people sort of got used to the idea of a lockdown, although in Bangladesh, I must mention, there was really never a strict lockdown. I mean, every time a lockdown was announced, for the first 1 or 2 days, people complied, but then it was quite loose. And in September, all restrictions on public transport, etc., was removed. So a strict lockdown really never worked here, except for a few days. So for the informal sector, we did a lot of work on slum dwellers, domestic workers, etc. So there was we did some research that, gave us some interesting results. There were some things about this pandemic that, of course, it's unfamiliar to everyone, but the communications around it was very unclear for informal sector residents as well. So for instance, staying at home or social distancing in the context of urban slum dwellers, it didn't make sense, right? So when you share one small shanty room with 8, 9, 10 people, and you have to work every day to earn, be able to eat, the staying at home, social distancing, quarantine or isolation when you're sick, all these things didn't make sense to these people, right? So there was a lot of messaging from the government, but that didn't apply to a large section of the urban dwellers. At the beginning, there were high fear and confusion, panic regarding the infection. But from March, April, May, by June, there was a sense of complacency. And it was primarily because the infection rates in Bangladesh, luckily, was not too high. And interestingly, it was the poorest segment of the city dwellers were not affected as much as the richer segment. So very quickly, people started talking about COVID as a very urban rich disease. Only rich people get it. Only people who travel in AC cars and have ACs in their rooms get this disease. So there was a sense of complacency. So the fear of life was very short lived. It's very quickly, the main concern among these people was livelihoods, how to maintain their livelihoods. No one really cared much about getting sick. So at BIGT, we did several rounds of a livelihood survey to look at the impact of COVID on different sectors. And obviously, we saw that there was a reduction in income in all sectors, but the reduction in income was much higher in the informal sector compared to the formal sector. Because of course, in the informal sector, workers have no protection, no security. And in a lot of cases, they lost their jobs immediately without any sort of compensation. So from the survey results, we see that 6% of slum dwellers migrated back to rural areas in April and further 13% in June. The cash transfers that were handed out by the government were insufficient and very sporadic. And we'll talk about this later, but the problem with the informal sector is there's no formal listing. There's no formal record of who's where in the city. A lot of slum dwellers are here without any sort of registration or record. So without documentation, it was hard for the government to hand out food aid, which is easier in rural areas. But the upside was that because the lockdown was never fully prohibitive, formal sector didn't have a choice but to shut down completely, right? So if you have a formal shop in a shopping mall, you have no choice but to keep it closed. You can't, just open it without people noticing. But in the informal sector, street vendors, informal entrepreneurs, they kept on, a lot of them continued their operation. And we saw a lot of interesting and funny videos of how, when the police comes, everyone shuts their doors and the streets are empty. And as soon as the police leaves the area, everyone is back and the marketplace is back. And it doesn't look like there's anything going on differently. So that was the advantage of the informal sector. So although it was affected negatively, of course, but some level of operation was still up and running. So we look at a few cases, and very quickly I'll just tell you what the effects were. So street vendors, I think, were one of the worst affected informal workers. And there's an estimate that 400,000 vendors were affected in Dhaka, but again, these are not accurate numbers because we don't have a formal listing of street vendors in Dhaka. We don't know really how many there are and how many stopped operating. So even if they were operating covertly, even when the lockdown was not very restrictive, the customers were sparse. Of course, demand had got down. So there was a loss in sales, and specifically because the first wave of the pandemic covered the two Eids, the two religious holidays, which are really the peak times for business in Bangladesh. So, and a lot of businesses rely on sales during these two peak times the rest of the year. So this was a huge shock for many businesses, informal and formal. So vendors did report reduction in profits from half to a fourth of their pre-pandemic profits. So what did they do? Well, they had to face food insecurity. They had to use up their savings. They had to borrow from informal sources when they could. So that was the street vendors. Another sector that was drastically affected was domestic workers. So because a lot of domestic workers in Dhaka, they work part-time, they're not living. So they go to households, work during the day, and then go back to usually slums where they work, where they stay. So because city dwellers were very scared of the infection spreading, so immediately, especially in apartment buildings and compounds, they did not allow any domestic workers to come in and out anymore. So domestic workers, for them, there was an immediate loss of work as soon as COVID became public, when everyone knew about it. So there's an estimated 1.7 million domestic workers in Dhaka. Again, there's no official registry or documentation, so this is again an estimate, and they mostly reside in slums. And 54%, our survey results show that 54% of them were unemployed by June. 37% returned to their hometown, the rest stayed and tried to manage. A lot of them turned to begging. There's a big food crisis for them. Some interesting sectors were the delivery service, where obviously because of this changed context, there's a huge boom in demand for delivery services. So after COVID, we saw 30 new delivery businesses spring up in the city. There was a huge boom in food delivery services. So for example, Food Panda, which is the popular food app, saw a rise in 300% in sales. Grocery delivery, again, for the circumstances, one of the leading companies, they saw 150% rise in orders. So naturally, these companies, they started recruiting more people for delivery and for logistics, handling, etc. Daraz, which is like an Amazon.com sort of platform, they reported hiring 4,000 new employees after COVID started. So what this did is, our analysis is that it created some opportunities for formal employment for a lot of people who are in the informal sector, actually. So this is an inroad for a lot of people who are in the informal sector to enter the formal sector because this opportunity had been created. Another interesting sector that we did some research on was online female entrepreneurs. So these are businesses which are not registered completely in the informal sector, but they operate on Facebook, mostly on social media platforms. They have pages where they sell mostly locally made products. So we had a series of surveys on them. We followed up on a sample of female entrepreneurs to see how they coped. And we found that initially 24% left the business. And these were mostly, they're too small, not viable, not, it was not possible for them to continue their business at all. So they closed their pages completely and left the business. But the rest of them, although they had some initial loss, specifically during the Eid period, the religious festival period, they did pick up later. And they were very flexible. People who were selling clothes suddenly started selling masks online or sanitizers online. And because of the nature of their operation, when you're online, your overhead is very low. You have the choice of changing quickly your products. You're very flexible. You can scale down, scale up. You're not paying rent. You're not paying taxes. You don't have a lot of employees. So we're very flexible. So they were very creative in staying adrift during the first shock. And then, they did pick up later. When we followed up, we found that, after that initial shock, they picked up. Another interesting case was ride-sharing services. Here, so in the case of food delivery, we found that, there was an opportunity to move from informal to formal. But in ride sharing, we see the opposite. We saw that a lot of people had to move from formal to informal sector. And this was because ride sharing services were prohibited during the lockdown completely. So what were these drivers going to do? So a number of them just left the sector. So the formal number of ride sharing drivers went down from 100,000 to 25,000 during the first wave of the pandemic. And what they actually did was they were standing by the roadside with their bikes or cycles and, informally asking people to avail their services. So from going from formal, instead of working for Uber or some formal platform, they were now informal. They were just, hawkering their services by the roadside. So they moved from formal to informal sector. Rickshaw pullers, of course, is a big sector in Dhaka city. It's a major form of transportation, and they had an unemployment rate of 11% and a huge income reduction, 54%. So they were also adversely affected. So in general, when we look at these, when we found the evidence for all these different categories of people, the coping strategies that were common for them is first depletion of savings, reduction in food consumption. So 47% of our sample from our livelihood survey reported cutting down on food consumption. A lot of people were borrowing, although that was restricted because, who do you borrow from? Your neighbors and family, everyone's in the same situation. Buying on credit from local groceries, and of course, move to less secure forms of work and more informal forms of work. And as we saw for the domestic workers going to, begging on streets. Most people reported friends, family, and community support as their main safety net. Interestingly, government or local government formal sources were not a major source of support for the urban poor. Only 8 to 9% of the poor received government aid after COVID hit, which is very, very small. By June 2020, around 76% reported that they were back to their original profession and were able to continue. 17% had lost their jobs permanently, and 7% had to change occupations. So that was, changing of occupations was also one form of coping for them. So moving on, I'd like to spend some time talking about 3 stories that we closely followed while it was happening. So one was COVID management in urban areas. The government of Bangladesh, they quickly, one of the things that they wanted to do was, like many other Asian cities, they identified hotspots or red zones where infection rates were very high. And they listed 45, I believe, sites in Dhaka. And as a pilot, they chose one area, Raja Bazar, and imposed a formal lockdown there. Okay, so this was a pilot. This was a very formal state-controlled lockdown. So what did they do? So this started on the 10th of June. The area has about 50,000 residents, and this was managed by a committee that had the city corporation, police, government health department, social welfare department. So it was very state managed and state centered. And they had picked some selected volunteers from local area to help them out. There were local volunteers, but they were selected by the state. So what they basically did is they closed off the area. There were gates that were guarded, closed them off, and they had controlled food supply going in, controlled, health service going in. Only a few journalists were allowed to go inside. Only pharmacies inside the area were open. Everything else was closed. They had set up, sample selection, testing mechanism, booths, and isolation centers. Everything was controlled inside. So how did people react? So the day before the lockdown started, most people who worked outside the area, they fled the area. They left. So a lot of the men actually left the area neighborhood before June 10th, the night before June 10th, before the gates were closed. So their families were inside and they were communicating with them across the gates. There were a lot of pictures in the media showing, there's this gate and there are people on both sides talking to each other or exchanging food. The men would bring in food for their families. So that's how they were interacting. And basically, the lockdown as it was envisioned by the government lasted for 1 day. So by the third or fourth day, people started to complain and they were not complying anymore. They were trying to climb over the gates, get out, it wasn't working. So after 3 weeks of trying, I think this is abandoned. And the rest of the 44 areas that were identified as red zones did not, the government did not proceed to do the same intervention there. So obviously it didn't work. Okay? But in contrast, we have another case, and we actually spent quite a lot of time, 3 months in the community, trying to understand what happened in Coral, which is one of the biggest slum in Dhaka. Okay? So this was a highly neglected area for the government. There was no government intervention actually, but given the situation in slums, how people live there, there was high concern because there was high risk there. So what we found there was that in Coral, the community, they managed the lockdown themselves. They did things that were very similar to what the state did in Raja Bazar. Okay, so the interventions were the same. They divided the whole slum into 13 or so blocks. In each block, they had an army of volunteers. They were controlling entry and exit. They were controlling people gathering. They were setting up isolation centers. They were setting up hand washing stations. They were doing exactly what the government was doing inside the slum. They were fundraising through social media platforms. Okay? And what happened was that people complied. The community actually, we followed them for 3 months, and they were very successful in managing, and the infection rates were very low. Okay, so what was interesting is that they were doing the same thing that the government wanted to do in Raja Bazar, but they did. This was completely community-led, and it was successful. Okay? I could talk more, but just looking at the time, I just want to go for tell you 2 more stories. The other concern in urban areas was that, you know, the government has very weak records or documentation of people residing in the informal sector in Dhaka city, because these are mobile people, migrants from outside, very difficult to track. So what we needed was a quick and very effective coverage of this sector. You know, the rickshaw pullers, vendors, getting food aid to them was a big challenge. Not only was the government coverage weak, the government aid was insufficient. So what we saw was a surge in volunteer groups, specifically young people, youth groups, and this is particularly pronounced in urban areas, who were very quick at crowdfunding through social platforms and mobilizing huge numbers of volunteers. So the Bidanondo is one of the most prominent youth groups, and they raised over $1 million in the first round, and they reached 1 million families in less than a month with food aid. And they were cleaning public transport, they were providing support to health workers, they were setting up hand washing stations, and they were giving out food aid, hygiene kits, etc. And you know, this was quite a pleasant surprise for us. And similarly, there are many more. In our paper, we talk about some other prominent groups. The Pashayachi initiative, for example, they did some interesting work. They focused on sectors. They focused on rickshaw pullers, they focused on sex workers. They found some traders and craftsmen. So for instance, people who shops who used to sell books, who were not being able to sell books anymore. So they created online platforms for them, and they were selling books online for them. So they became that intermediary. So all these young people, volunteer groups, really came into action. And I would say, I mean, in my lifetime, I haven't seen anything like this in Dhaka. So the crisis did really bring these people together, mobilize them. The last example that I'd like to share, this was something that we were involved in on behalf of BIGT. I was working on this too. This was the mask campaign. So this was interesting. It started with Yale University did a large-scale RCT in rural areas in different countries, where they were, the initiative is called Normalizing Mask Wearing, a norm, and they were distributing free masks and educating people on the use of masks. And the research that they did initially found positive response. So what we did was took that evidence to the city corporation in Dhaka and some NGOs. And they picked it up very quickly, very enthusiastically. And then there was a big collaboration. So there was a team of people from us, the different research organizations, Yale University, IPA, BIGT, and some local NGOs and some youth volunteer organizations. And we sat together and thought, okay, we have this research that shows that this works. What can we do about it? So then this team, we selected strategically some times and places where we could do this. We could try this intervention out. So we picked busy shopping centers, bus stations, and the timings we picked were the 2 Eid times. That's when people mostly travel the most and go out the most. And especially the second Eid, there's a cattle market. That's when people sacrifice cattle. So there are huge cattle markets within the city. So we targeted those areas. And we as researchers were involved, so we could make observations and make quick adaptations to the intervention. And we also did reinforcement through community actors. So for example, in the cattle markets, the the informal leaders of the cattle markets were, we also approached them and made sure that they were also sending out the messages regarding proper mask wearing that we were sending out. And huge numbers of volunteers were involved in this initiative. And as a result, this was also a randomized control trial. And in 4 weeks, we found that proper mask wearing increased by 12 percentage points compared to control areas in intervention areas. So this was a big collaboration between different kinds of actors, and it was seen as a success. So I won't take much more time, just concluding on our take on from our experience. The informal sector was affected badly, yes, but in Dhaka they had some advantages in the sense that there was some flexibility. Lockdown was not completely prohibitive for them, so they, even if I'm a street vendor who used to sell food and there's no one on the streets to buy my food anymore, I can switch to selling something else. I can switch to selling masks. I can switch to selling other things in other places. So informal sector workers had that flexibility, which was not possible for formal sector workers. And the other interesting thing, the main thing that I took away from the stories that we saw, is that we usually have an idea that in urban areas, communities are not very strong compared to rural areas. We think that in urban areas, people don't know each other, so they don't help each other, and they're sort of fluid. There's no community. But that idea, I think, was challenged. We found that in the face of a common crisis, people did come together. And there are community. The example of the Coral slum, we saw a very strong community action there. So that was an interesting finding for us. Also, that when people mobilize, they're able to gather resources. So in the Coral slum story, there were some very interesting stories that they had posted on Facebook, and they posted on the pages of local government officials. They reached out directly to the Prime Minister's office through Facebook, and they mobilized resources from there. So even if they were physically restricted within the slum, they reached out using digital platforms and they mobilized resources. So they were able to do that. The state, on the other hand, has very weak reach into urban communities, and this has become quite obvious after COVID. That we have no central listing of who's where, who's doing what, how many rickshaw pullers do we have, how many vendors do we have. So the state has very weak documentation, very weak outreach into urban communities compared to rural areas. In Bangladesh, rural mobilization is very well known through NGOs and government. But in Dhaka, it turned out that the government didn't know exactly how to reach people. And the dire need of a social safety net mechanism for informal workers, this became very, very prominent, because the financial stimulus package that the government announced was obviously for the formal sector. Informal entrepreneurs, businesses, they did not have access to any of the financial support that the government was offering for COVID. So now people are talking about, it's obvious that we need to set up a social safety net for urban areas and informal workers. So that has come up in the policy discussions now after COVID. So, and from some of our research and interventions, we found that multi-stakeholder engagement is really important in urban areas because there are so many actors. So volunteers, communities, government, city, corporation, NGOs, all of these actors need to work together. And that when they did, that's when it worked. When the state tried to work on its own, it didn't work. So that was the main takeaway for us. Speaker, I'd be happy to answer any questions. Thank you.
Thank you very much for that very interesting presentation, Mehnaz, for the very different and I guess diverse case studies that you have shared with us. So please feel free, everyone, to post your question into the chat box, or if you prefer, you could turn on your mic and verbally state your question. We do have, well, two questions here. So I guess, Mehnaz, the first question is from Swede Stanton Trudy. So you mentioned people adapting by moving between formal and informal sector. Can you speak about moving within the informal sector? For example, the domestic workers, many, as you said, became beggars. Were there barriers to them doing other informal work? For example, food vendor?
Well, first of all, it's not just as informal sector. It's not very easy to just switch. You have to have the right networks and resources. If you move, imagine if you're a domestic worker and you want to move into food vending, you need to invest something. You have to buy goods before you can sell. In that situation at that time, that was very unlikely to happen. So you had to move to lower forms and more insecure forms. I mean, begging, you don't need, the day you don't have food, you go out and beg for food. So it's very unlikely that, you know, in the informal sector, you switch at a time when supply chains are restricted, you don't have savings, you don't have anything to invest. So unlikely situation.
So thank you. And here's another question. Well, it's from me. I was just interested how the youth played an important role in most of the community-led initiatives that you've mentioned. And so I was just wondering if you could share some insights on what made the youth feel empowered to lead community-based initiatives during COVID.
Right. So I think one big factor is, you know, the power of social media, digital platforms where youth were able to come together. And also I must mention that they did get support from other actors. I mean, the government did support, for instance, when Bidanondo, they were distributing the supply chain, both the government and the corporate sector, they came forward to help them. You know, the government provided security when they were distributing. And the corporate sector, they provided supplies, right? So when all the sanitizing that they did in the public spaces, in the buses, the products were provided by the corporate sector. So the youth came together through social media mostly, but they were really encouraged and supported by the other formal sectors as well. So that must be mentioned.
Okay, thank you very much, Mehnaz. So let's give Mehnaz a big hand of applause. And yeah, for others who would have questions for Mehnaz, please just write them down into the chat box as we move into the next presentation. Later on, we hope to have a Q&A portion as well. Okay, thank you very much. So our second presenter is Elisa. So Elisa Sutanudjaja is a co-founder and director of Rujak Center for Urban Studies in Jakarta, Indonesia. So it's a think tank that focuses on the urban and regional issues based in Jakarta. Some of our focus and advocacies include right to adequate housing, mobility, climate crisis, and the city issues, including informality and urbanism. So her background is in architecture. She is also an Eisenhower Fellow. So Elisa will be talking about a comparative study on micro-lockdown policies in Jakarta. This is a paper that she has co-authored with Vidyatani Zara, Kairunisa, and Rima Aisha. Without further ado, Elisa.
Okay. Good afternoon and good morning to some of you, and good evening to Melbourne folks, I guess. So here, okay, let me share my presentation here. So actually, this is my second presentation. Yesterday, I also present a part of the RSA Policy Expo grant, which is a joint program with Melbourne University and others in here. But yesterday, we focusing on the public housing issues and how government inability to distribute public housing stock is a blessing in disguise during pandemic because the empty public housing become a isolation and quarantine center. So today we're going to talk on the different issues, which is about the lockdowns in kampung. So kampung is more like informal settlement. Full screen. Sorry. Yeah. Okay. So it is like the framework of the presentation. So I'm going to talk a bit about Jakarta. I presume that everyone been to Jakarta, so it's nice to have a little bit information about Jakarta. And also, we also want to introduce what happened during COVID-19 and about the neighborhood-based strategy, the micro lockdown, and some preliminary takeaway that we learned until today. So actually, since the beginning of the pandemic, which is March 2020, we've been looked into a lot of data that published by Jakarta government. They are quite transparent and have a very good platform that informing us about daily case and etc. So this is not only part of the current activities, but also include our past activities since 2020. So, here's a bit information about Jakarta. So it's the capital of Indonesia, hopefully still capital. It's the second largest metropolitan area in the world. So the total population is 10.4 million for the Jakarta alone, but for the greater metropolitan area is 31 million. And the density within the city is a 50,000 per square kilometer, but there are some area which is have a striking density could reach like 60,000 per square kilometer. So it's a little bit crazy there. So I think like most global south cities, you found the informal neighborhood side by side with the formal neighborhood. So for this case, it's called kampung. So like even during the colonial time, kampungs are already side by side and situated of quite close proximity to the center area or the formal neighborhoods. And because of the the resident is coming from many part of Indonesia, so they are also have a very diverse in ethnicity and also level of income, and they are mostly work in informal sector. So and they also have a very unique social structure. And until today, so the map on the right side a bit about Jakarta. We try to use the same scale in 2017. We calculate about 29% of Jakarta land area is consist of kampungs. So we try to also summarize the kampung value, what make kampung important for city like Jakarta, because during the pandemic, apparently this value is either abused or could be by government, but also become advantage to passing by difficulty during the pandemic. So kampung is a place where you learn how to be city people. You know, you're coming from the rural area, then you learn about how to live in the city, and it's a space for to meditate, practice of commoning when you also practice have a social support system happening, like for example non-bank saving group, we call it arisan, and food sharing and simply togetherness. So this thing is very important during pandemic, and it is a substantial note in the urban economy because many economic activity in Jakarta is still pretty much dominated by informal sector, and it's a supply for affordable housing as well. So but during the earlier time of the pandemic, we have the day one in pandemic is in March 1st, 2020. So it's an imported case, and the first two patients got infected in the prominent neighborhood, and they are coming from upper middle class. But only within like from the day 5, the Ministry of Health spokesperson said that the rich should protect the poor so they can live a normal life, while the poor protect the rich by not transmitting the disease. So this one is the first prejudice against the urban poor. Even though many of the cases in Jakarta is actually located in the rich neighborhood. Like for example, this is the map that we draw, compiling slums area and also the COVID cases. So the green note in the map actually is indicating slums, while the red is the degree of the COVID cases, the positive cases. Like if you see the more red, then it's more you have higher cases. So even though it's already passed, it's already 2 months from the first COVID cases, you see that slums actually is actually not part of the epidemic epicenter. It's still affluent neighborhoods. So because the state response is so slow, they took 1 month to release a new regulation, a new policy to tackle the pandemic situation. Even though we already have health quarantine law in 2018, but the president decided not to use the highest form of quarantine, because in order to do that, then you have to use a lot of money to support all kind of basic needs, including the cattle, not only human. So it have to be fully supported by the state. But then he didn't didn't use that, and instead he opted for the social restriction instead. So during this 1 month, then the people have to rely on each other. So even the urban poor opening up donation in the platform donation, gathering public money and redistribute the money to the other urban poor. So yeah, this is what happened in the first month of the pandemic. And about the density also is actually not the case. So even in the earlier time, I think this is the data coming from May. Yes, this is from May. If so, the density in this case, if you see, is become more darker, then it's more dense, while the dots there is actually the cases. So it's not correlated between the density and the cases. And another evidence that we get there to debunk the statement from the spokesperson is the comparatives between neighborhood who also have high cases. So the first one is Pegadungan, which is like 80% of is a gated community, while the other one is a Kenari, which is 60% is a kampung, and the rest is commercial district. And of course, Pegadungan have a lower density rather than Kenari, but they have more risk perception better than Pegadungan, which is more like affluent neighborhood with a lot of rich people and etc. And even they have more better information compared to the Pegadungan, and better knowledge in rather than Pegadungan. So this is another different studies that we also conduct in the earlier phase together with Lapro COVID and also social resilience lab. And there's also a question during the survey, and apparently people in Pegadungan, I believe that they will not catch COVID, even though they're like the highest, one of the highest during that time. So yeah, And another thing, because of the open data from Jakarta, we know that the typical cluster from COVID-19 in Jakarta is coming from the office cluster, from the family home-based cluster. It's a multi-generation family. It's not only happening only within the poor family, but also with middle class and the rich family as well. And again, it's a congregated living setting cluster, religious congregation, mass gathering, and etc. And we also have a tourism-based cluster. So one time there is a big tourism activity in Turkey because of this one movie that so popular in Indonesia. So many people go there and they come back with a lot of Omicron case. So this is another crazy story during pandemic time. So for Jakarta, they need because they heavily depend on the tax income and also from investment. So during the first year of the pandemic, they have to refocus the budget, but they cannot really do much. So the governor kind of like pushed to ask all parties to collaborate in facing pandemic. So they requesting companies to help, and they also set up a platform. So they set up a platform that enabling companies or donation cool treats to the kampungs or other facilities like orphanages or nursing home. So it's very simple platform where you can choose which neighborhood that you want to help and then just click it. So it's become platformation, and the funny thing is this gotong royong, like this working together for the common cause, is proposed by the deputy governor, but fully realized and the SOP is produced by McKinsey. So yeah, it's quite funny though. So we understand that the kampung value somehow being utilized and promoted during the pandemic, and there's a lot of policy that coming from the government that tackling directly to the neighborhood base. So it's either coming from the idea that kampung is considered as a could be a danger in the future, because of they are more dense than other neighborhoods. So that's why a lot of policy happening in the within the small neighborhood or like kampung. So one thing that's interesting during the earlier time of pandemic. So there are the government, even also universities and NGO like us, also producing top-down manuals about how to handle the pandemic in kampungs. So this is several books that the cover of the books that are manual that are produced by all kind of government agencies, including Jakarta government. Until October, I think around 10 top-down manuals. And the manuals kind of like emphasize the role of kampungs in building their community resilience and volunteerism. So again, Indonesia also facing, because of the pandemic, the economic slowdown and etc. They have to grab anything they can to support and to finance the activities. And the study area is actually where our kampung, our partner kampung located. So there are 5 areas. Is in Kampung Aquarium, Aceh, and Tanah Merah, and Kampung Muka, which is all in North Jakarta, and Pademangan Barat also in North Jakarta. So and also Tanah Merah. Tanah Merah is the one on the red side. So if you see the red color, meaning they have the similar strategy and tactic, while the blue color have coming from different agencies, and while the green color is also have different agencies as well. I will explain more in the later slides. So we also understand that Yes, there are value, but there are also vulnerabilities that happening in kampung. We differentiate between two. There's a latent vulnerability that already been there since before the pandemic, like for example, lack of basic infrastructure, security of tenure, and ongoing and upcoming infrastructure projects that keep coming even though it's during pandemic, and the proximity to the health facilities. Like for example, this even in the kampung that we study, the proximity to the clinic, hospital, or the to the government clinic is not close proximity. Even for Tanah Merah, the one on the red, they don't really have a health facility inside the kampung. So the other one is about the impact vulnerability due to mobility restriction and closure of the public space. Like informal vendors, they really depend on the public space and also office hour and schools. So it's very difficult for them to adapt in the earlier time of the pandemic. And so we divide into three. Which is a community lockdown, and the second one is a micro lockdown. And there's a long abbreviation for micro lockdown to it's a government term, and the last one is a kampung tangguh, or for English name is a resilient kampung. So for the community lockdown, we also experience it together with the communities in Kampung Aquarium, Kampung Tanah Merah, and Kampung Anak Kali Ciliwung, all in North Jakarta. The background is because of the 1 month absence of mitigation policy coming from the government, so they have to take something to do something to protect themselves. And the second thing is because the popularity of lockdown measurement coming from Wuhan, so everyone talking about lockdown, and then finally decide to put a portal, means that this kampung is under lockdown. So for example, like this is a photo by Ibu Darmadiani showing the first day they put a portal coming from a lot of scrap material, and they even put notice from the police, put it on the making a big banner and put it on the front yard. This is another lockdown strategy, similar. Sometimes they put funny statement. I cannot really translate because it's become not funny in English. So try, but basically have the same measurement. Please do not enter the area. And because the road become blocked, then some kampung also utilize the road, using the road into public activities like sport activities. For example, this is one of our partner. One time they call us and ask to run a table tennis. Can we borrow the table tennis because we're going to use it during lockdown. And some of them turn more into urban farming and etc. So this is basically community based. And they receive a lot of donation, either from the company or even they also collecting money among themselves and redistribute the goods among themselves. So during that time, there is also emerging community initiative, for example, so they're providing their own prevention tools because suddenly masks become so expensive. And even the hand sanitizer also expensive. So they produce their own and they redistribute it and sell it among others. And also they using platform based to collect public donation and provide cash for 800 families. So like for example in the picture on the top. And they're doing a lot of economic activities because some of the kampung have a cooperative. So sometimes they borrow money and then buying food supplies in bulk and then redistribute and sell it for profit a bit, and then they get money and then keep the money rolling. So they also start the urban rural supply network, so buying rice directly from the farmer and redistribute themselves. So every time, I think for one truck, for one shipment could reach like minimum 10 tons. So it's really big shipping actually. And the second one is it's a government-based policy. So it's a government policy. So it's apply and like, hang on, 3 months after the first case. So it's already quite late. So we call it micro lockdown, or it's a PSBL. So we call it it's a neighborhood scale social restriction. One of the cases in Kampung Pademangan Barat. So it's because the reason why they want to do that, because the government said this is a phased out process. We are already under big scale social restriction for almost 2 months. Then in order to phase out, then we better to do it based on the neighborhood. And it's inspired by an op-ed and the presentation from the Dr. Sulfikar Amir. So in his presentation, he mentioned that it's easier to lock in the community rather than to have a total lockdown in order to have better economic and social activities. So here's the basic idea about the micro lockdown. And the government have a criteria for its kampung or RW, neighborhood unit, and they check it every week. And the duration of this PSBL is every 2 weeks, and they review it. And if it's used still under the infection rate is still quite high, then you still under PSBL for another 2 weeks. And apparently we also doing a mapping for the first 3 terms of PSBL, and most of them is coming from the affluent neighborhoods. So even until July is still not infected or affected to kampung. There are some kampung, but then the gated communities is still a majority for the PSBL area. So this is a situation in Pademangan Barat 2 years ago when they are under micro lockdown or PSBL. So it's so empty because everyone had to stay inside home. So they also installing checkpoint. So even though this is a government policy, so the government didn't give any money for the residents to do all of this, and they only provide. Can you hear my voice?
Yeah, we couldn't hear you, Elisa. Yeah, I think it's better if you have the headset because we could hear you. Oh yeah, there.
My headset's not It's okay now?
Yeah, we could hear you. I think if you go near the computer, we could hear you better.
Hello?
Yeah, that's clear.
Sorry. Yeah. So the government didn't provide any budget to do the micro lockdown, so they have to find it their own, and they didn't give any tools how to do micro lockdown, despite they provide a lot of manuals. So here's some takeaway from the resident. So they have to collect their own money. So they have to ask, so they need like 45 million. So it's quite a lot of money, like $3,000 for those 2 weeks in order to provide incentive for guard, because they also provide a security portals in the front of the kampung. So they also pick up some money like entry permit for the residents who come to get inside. So the resident have to contribute money in order to get that. So the government only give like limited first aid, but again, limited instruction. So they have to figure out by themselves. So it's quite funny for a top-down policy, but at the end of the day, the residents have to think a lot of things and provide their own supplies. And another thing is called Kampung Tangguh Jaya. So this is called a resilient kampung. Originally, it's a study and proposed by University in East Java and implemented by East Java Police Department. So it's not coming from the government, but it's coming from the police department. but it was picked up quite popular in East Java because at that time East Java didn't have budget to handle pandemic, and while the police department have a lot of budget, so they're refocusing the village aid money and then finance this Kampung Tangguh, and then suddenly become a national program and implemented in the regional police agency, including Jakarta. So in this case, we also look into two different kampung, including Pademangan Barat, the same kampung as before, and Kampung Muka in North Jakarta. So it's more like celebratory. You see a lot of banners, the presence of police there. So if you read the manual from the university who's produced it in the first place, it's about human resource, health information, the importance of culture, physiological, and also logistic. But when implemented by the police, it's totally different. So it's more focusing on the test, treatment, and tracing. So it's not supposed to be their job, but they're doing it as well. And it's about prevention, like they have to check whether you're really wearing your mask or not. And they also have this food program, like making a fish pond and urban farming in many kampungs as well. And they distributed to participants of the Resilient Kampung program. So this is another urban farming they conducted in North Jakarta. So again, the leader of Kampung said, if we are honest, the Kampung Tangguh actually have no effect on us. It's just like a celebration program. It's not really useful for us. And then he also mentioned that the important thing is what happened during the pandemic is the solidarity of the residents, and basically they have to take care of everything, even though there is a lot of government program underway. So what's shocking is what's next for Kampung Tangguh. Apparently police have a different thing in their mind. So they utilize Kampung Tangguh not only for the pandemic now, but also to do narcotics, like illegal drugs trafficking, tracking. So they even try to use to monitor the activities or between mass communities like groups. That's why they transform from the pandemic situation into more like surveillance style program. So I think it's we believe that this is something problematic in the future, and they utilize the pandemic as a tool to get into or get inside the community, embedded in the community. So here's the preliminary takeaway. So actually it's quite, we're doing a comparative analysis between these three. Who is one coming from, is the initiative from whom, and who's the one who planning it, and what is the focus of its three different approach. Like for example, the focus for the community-based lockdown is to access restriction, to positive case countermeasure, to building social safety net. While the focus for the micro lockdown is more focusing on the prohibiting crowding or to access restriction. And for the Kampung Tangguh by the police, is more like now including about food security, about radicalism, about drug trafficking, and etc. So it's all over the place. So, and also about what kind of quality of participation. So for community-based lockdown is more like very active, while for the Kampung Tangguh in police is a passive, while for the micro lockdown is a government also utilize a coordination with army and police. So the funding also have a different source as well. Even in the Kampung Tangguh, they have funding from the police budget, but then the police never really ask the community to handle it. So they have to, they're the one who spend it directly. And the sustainability of its program, actually it depends with what kind of degree of organization. So if you have more active and more, for example, suitable organization like cooperative, then it's more sustainable than the other. So like for example, in the in the Kampung Aquarium for the food security case. They have cooperative, so they can buy a lot of food supplies and then resell it to the member of the cooperative. While for Tanah Merah, since they don't have the means of organization, so they have to depend on solidarity and donation, etc. So yeah, so actually this is something that we're going to present it back to the member of the kampung that we work together. So this is going to be our task to more finding to have more to have more concrete analysis what we learned from the 5 kampungs. So what next we're going to do FGD with communities to report back the result of this comparative analysis. So we also have an active involvement in preparing disaster risk management document for the Jakarta government. And we are quite worried about the idea of Kampung Tangguh and what happened now. We interview Dr. Ian Wilson. He's an expert in mass organization, so and quite very familiar with a local organization in Jakarta. So he afraid that Kampung Tangguh could lead a removal of Ormas. So this is common mass organization because there is a very strained relationship between police and the with the Ormas. So yeah, so hopefully nothing happened, but we looking forward to see what happen soon after police decide on what next for Kampung Tangguh. Okay, thank you. I think that's the end of the presentation. If you want to read more about our findings, I'm sorry, but it's in Indonesian language. You can go to the website here. I will type it down, but you can easily translate it to using Google Translate. Okay, thank you.
Okay, thank you very much for that again comprehensive presentation, Elisa. So I guess are there questions from the audience that you would like to ask Elisa? We have, I guess, a few minutes before we move on to the next presenter. You can open your mic or you can write it down in the chat box. Yeah, so I guess I could kick it off with the question of what was interesting in your presentation, aside from the very diverse examples of case studies, both community-led as well as from the government-led initiatives, was how, I guess, kampung residents responded to what they can do while on lockdown and how spaces have been taken over, not by vehicles, but by people. And it was interesting how the street spaces have become public spaces in a way when they were requesting for the table tennis to be placed or to be they were requesting for sorry, I was timing as well. Sorry about that. Yeah, so I was just wondering if these activities, other uses of public space beyond vehicle movement. I wonder if in COVID normal situation, has this shifted back to to becoming road spaces, or has there been opportunity to actually shift it into more public, more diverse areas for diverse activities?
Unfortunately, one thing that you are left now is just blockade. You still saw a lot of portals in the neighborhood, and some of them still locked. So some neighborhood utilize that in order to get a private space for themselves. So I know, so this neighborhood is not part of the study, but it's located near my area. So they block the road using portal, then they utilize it as a car park. Until today, and they decide not to open the portal because if they open the portal, then suddenly they lost the free parking space. So that's also happening in I saw it in several neighborhoods, those kind of things. Yeah, so maybe you saw that kind of things in I don't know in in global north. Like I saw a lot of things happening, closing down the road and become more like public park and etc. Unfortunately, for Jakarta case, the one that really happening is widening the sidewalk, which is good. During the pandemic, the city government keep doing the construction project, including widening some trottoirs in the public area, and also dedicated bicycle lane. We have now almost 30 kilometers side in two sides in main area. So it's part of the product of the pandemic.
Yeah, that's good. So there are some, I guess, positive uses of public spaces, but there are also negative uses of public spaces. Okay, so I think, are there any more questions from the audience? If there are no more questions, then we move to the next presenter, who is Ian Jayson Hecita. But before we do that, let's give Elisa a big hand of applause. Okay. Thank you very much, Elisa. So now we move to Ian Jayson Hecita. So Jayson is Assistant Professorial Lecturer at the Department of Political Science and Development Studies of De La Salle University in Manila, the Philippines. Concurrently, he serves as Lead Policy Research Specialist for the Institute of Governance of DLSU. His current research projects involve COVID-19 and metropolitan governance, sustainable transportation governance, and electoral administration. And very much, I guess, appropriate given that the local and national elections are happening soon. So you must be studying that, Jayson. Anyway, so Jayson will be presenting, so his topic that he will be presenting today is the governance and politics of local lockdowns, the experience of select Metro Manila cities. So this is a paper that Jayson is preparing with Ador Torneo. So on to you, Jayson.
Yeah, thanks, Durley. Greetings from Manila. Good afternoon from here. I understand we will just play the pre-recorded presentation to save some time.
Good day to all of you, to all our online viewers.
Could you hear that?
I'm Ian Jayson Hecita.
Yes.
On behalf of my co-author, Dr. Ador R. Torneo, we're
I'm sorry. Sorry about that.
Faculty members of the Department of Political Science and Development Studies of De La Salle University, as well as researchers under the La Salle Institute of Governance. We are pleased to present the preliminary findings of our research on the governance and politics of COVID-19 in metropolitan areas such as Metro Manila. What we'll present here is a snapshot of the preliminary findings we got from this research, focusing on COVID-19 lockdowns. Lockdowns have become, especially during the start of the pandemic, became one of the more popular and convenient policy measures implemented by national governments and local governments to curb or to prevent the increase of infection. While studies are very mixed on the effectiveness of lockdowns vis-a-vis the costs that it entail, one would argue that lockdowns can be are measures that may seem effective but can be unpopular given its adverse effects and impact. In this short presentation, we will look at the preliminary findings of our data gathering activities. We look at the institutional arrangements, particularly in the Philippines and Metro Manila, in the implementation of lockdowns. We'll also identify incentives, disincentives perceived by actors implementing lockdowns or any other physical restrictions or movements. We will present issues experienced by local government units in Metro Manila. And then lastly, we'll describe how the implementation of these physical restrictions, movements, lockdowns affect informal sector based on how they experience and perceive this policy. measures. The preliminary findings of the research were based on the following data gathering activities. We did some focus groups and key informant interviews with local government officials tasked in addressing COVID-19 in their localities, such as disaster risk officers, city development planners, and even incident command managers of select cities in Metro Manila, such as Quezon City, Pasig, Caloocan, and the City of Manila. We also did desktop review of materials, including policies, public of documents, plans, news reports on COVID-19 response. We did desktop review of materials on informal sector responses about implementation of lockdowns and its effects to them. And we're continuing, this is an ongoing effort to interview and get the inputs of local sectoral leaders from various cities. Where the cities were selected for the cases. Another criterion for choosing these cities is also their density. And of course, Metro Manila is one of the most dense metropolises in the world. Density and population, as well as COVID-19 cases. City of Manila serves as the nation's capital. Quezon City is more or less the what we call government capital, because most government agencies are located in that city. Pasig City is considered as one of the more innovative cities in addressing COVID-19 responses. And Caloocan City is perhaps one of the cities with the most populous community governments or barangays, because in the Philippines, aside from having a city or municipality, there's another tier of governance called barangays or community level governments. So if you'll have an illustration like a map, this is where the cases are selected or located. So what's the political and socio-economic policy context of the COVID-19 response in the Philippines? Of course, you have the populist strongman, President Rodrigo Duterte, who remained very popular at the height of the pandemic despite criticisms against his government, the ineffective and efficient handling of the pandemic. What Rodrigo Duterte was able to deflect the criticism towards his own people. And he was effective in communicating the response of the government through his usual weekly ramblings in a nightly TV program, usually that starts at 10 p.m. and ends around 1 a.m. Usually he criticizes government officials, even local government units who are not complying with the directive of the national government. Secondly, the interagency task force that's assigned to handle the COVID-19 pandemic is led by a former military general. Hence, the approach is very security and police based. The members of the task force are also the departments or members of the task force are also headed by former military and police personnel officers. The country relies on the service sector, anchored on the micro, medium, and small, medium enterprises, was heavily affected by the lockdowns, particularly the informal sector, such as the ambulant vendors, public utility vehicle drivers. You also had displaced workers, formal workers, both in the hotel and tourism industry. In the Philippines, since we are in a centralized setting, national government agencies, they craft the COVID-19 policies and they cascade this top down to the local government units who are expected to implement them. While the centralized setting can be rationalized by its ability to make decisions more coordinated and standardized, and responses more uniform, some of the local government leaders and mayors criticize because they are the ones they are the ones affected by the policies, and they're held accountable by their constituents, regardless if the policies crafted by the government, national government, are effective or lacking. Next is that the midst of the COVID-19 response of the government, there are several important policy and political events happening. You have the passage of Anti-Terror Act. Some of the critics think that this Terror Act is a way to criminalize criticism, protests against the government, particularly those who are affected by the pandemic. Then you have the program on implementing the jeepney modernization law. In the Philippines, the jeepney serves as a basic mode of transportation, where in this program, the jeepney drivers are asked or incentivized to give up on their jeeps in exchange of electric vehicles. But some of the jeepney drivers are insisting that the subsidy support given by the government are lacking and insufficient. And then there's also the upcoming national elections, where the COVID-19 response, its effectiveness, efficiency, and even its responsiveness becomes an important election issue. Hence, it may have an impinge an impact on the legitimacy of the Duterte administration and the current local government leaders. COVID-19 responses in the Philippines is characterized by its centralization, or the role of a top-down approach, and cascading policies, particularly on lockdowns. So central to it is the interagency task force on infectious and emerging diseases. This is headed by the Secretary of the Department of Health, but some of the departments, particularly the Department of Interior and Local Government and the Department of Social Welfare and Development, are headed by former military generals. The director of the IATF, which serves as perhaps a COVID-19 czar, is a former military general as well. Hence, one can argue that the COVID-19 response in the Philippines is heavily dependent on military and police approaches. The IATF provides the overall policy framework in order to the Department of Interior and Local Government, which is cascaded to the local government units, such as the city governments, municipalities, and barangays or community government. The DILG, they also supervise the police, which works in coordination with the local government units in the imposition, implementation of physical restriction movements, health protocols, and standards. Metro Manila mayors, because Metro Manila is composed of 17 independent, separately elected cities. They also had 17 mayors. They meet regularly in a platform called the Metro Manila Council under the Metro Manila Development Authority. This is where they discuss important issues, and they craft policy measures based on the national guidance, the guidance of the National Government Agency and the IATF and the DILG. Usually the MMDA serves a sort of an association of federation of city governments in Metro Manila. Usually they decide on issues such as traffic management, environmental governance. And under the COVID-19 pandemic, they have um, been vocal in their position about the role of vaccination, curfews, uh, the opening of establishment and malls. While the MMDA, they usually make unanimous decisions or unanimous positions on particular issue, but they cannot impose upon on a member local government unit. With regard to the institutional coordination issues local governments face, these are the things that they mentioned based on our data gathering. One, while there is a top-down and centralized implementation of policies, they still feel that policy vertical coordination is still fragmented. This is partly because some of the policies crafted or did not go through proper consultation with local government units. Hence, some of the strategic and operational level issues need to be addressed by the local governments themselves. One example has something to do with prohibition of public utility vehicles from operating, and there's one local government, particularly Pasig City, that did not follow some of the national government provisions precisely because the provisions were really unclear. Um, this case was published in the media and became the talk of the town, and even the president during one of his nightly sessions or a TV show criticized this specific local government leader. There's also a claim that there's weak guidance and support from the national government, but they have a strong control. But national government have a strong control on how local governments would operate or implement these national policies. These have this issue has forced These issues have forced local governments to actually innovate and use resources, while local governments had a hard time uh, because of lack of capacity and resources to actually implement important policies relating to physical restriction and its impact on the economy. Another institutional issue is that the policies are seen by local government leaders as highly securitized, though the claim there is that mayors and local government units had a very good working relationship with the specific police generals assigned in their locality. There's also perceived absence of accountability transparency mechanisms on how the national policies were crafted. According to one of the resource persons, this stems from the lack of consultation, maybe because of the time considerations, given the the urgency of addressing COVID-19, but also the lack of actual mechanisms for the national government to actually get the inputs of other stakeholders. And lastly, number 6, there's also lack of citizen participation, not only in national policies, but also in the cascading down of these national policies by the local governments, given the deadlines and the time constraint provided by the situation. Uh, Consultations with citizens were lacking and were proven to be insufficient. With regard to policy language of lockdowns, there's been an evolution of terminologies. During the start of the pandemic, mid 2021, We call lockdowns as general community quarantine. So this is the salient feature of this physical restriction movements, identification of people who can go out and couldn't go out, um, probation of financial aid, provision of identification cards, who can move or not move. Uh, the funny thing about the general community quarantine, it did go a lot of variations given the kind of policies the government need to craft under uh, the constraints of time and need. They also called they modified the general community quarantine to modified general community quarantine, a stricter measure which disallowed people from going out at certain times. They call it enhanced community quarantine or ECQ. Under this lockdown measure, PUBs were totally disallowed going to the public markets, to the malls. There was only a time window allowed to go out. There's strict implementation, the use of what they call quarantine IDs. There's also what they call a modified ECQ or a more relaxed ECQ. The kind of adjectives used to describe the kind of policy measures became a ridicule of netizens in social media in the Philippines. The way the government used several adjectives such as modified, enhanced in translating or the lockdowns, translating the policy of lockdown. There's also a term called used by local governments as granular lockdown. So these are strict lockdowns for specific locations or streets where there are emerging surge number of cases. From May August 2021, there's another term used. It's called general community quarantine with heightened restrictions. So here is under this classification, there are physical movement restrictions with regard to the number of people who can use public utility vehicles, with regard to public utility vehicles who can number of public utility vehicles who can operate, etc. From August 6 to 2021, the government used the term bubble or bubble lockdown. This is more of a inter-regional classification on how citizens can travel from one region to another. So for example, the Metro Manila is also called National Capital Region, was under a bubble lockdown. So people from inside Metro Manila cannot go automatically to other adjacent regions without proper documentation or authorization. And then from September 2021 to the present, the national government developed and implemented a new alert level system, what they call alert level 1 to 4, 4 being the highest, hence having the strictest form of physical movement restrictions, and 1 being the lowest or the most loose prohibition and physical movement restriction. Currently, with the declining number of cases, Metro Manila and almost the whole country is under alert level 1. What were the policy measures implemented by various local government units in response to the national policies on controlling COVID? So most of the cities impose curfews, and curfews usually they start around 8 p.m. or 9 p.m. Then they end around 5 a.m. or 6 a.m. The role of curfew is to, based on the documents of local government units, is to limit physical activities during nighttime. Although this was also criticized given that the claim of netizens that the virus is always there, no? Regardless of time. There's also police checkpoints imposed in streets. Some of our respondents, especially coming from the urban poor sector, claim that these checkpoints became hubs or points for potential abuse and extortion. Some claim that there's unequitable enforcement of checkpoints, only targeting those who are using bikes and motorcycles, which are usually used by people moving under the mode of transportation of lower income classes. Some sort of financial assistance or aid were provided by the city governments. Face shield was also required, aside from wearing a mask, a mandatory mask policies. You also have mandates on the wearing of face shields. And there's also a use of quarantine pass. This is an ID that shows that you are the authorized person in your house to go outside to buy food or medicine and other needs. Some say that some of the quarantine passes were faked by some citizens, and some said that the quarantine pass were sold by local government units. But these are anecdotal reports. Some of the cities, they had some sort of restrictions and prohibition on the use of public utility vehicles, but some cities use a modified approach in allowing public utility vehicles. Another common policy that may constitute a lockdown is the liquor ban. So in this city, some of the cities except for Manila, they impose a liquor ban. People are not allowed to sell or buy alcoholic drinks, no? Because the argument there is that drinking alcohol, particularly in the culture of the Philippines, it's a social gathering, and it may invite unnecessary crowding. Local government officials and leaders, given that lockdowns are usually unpopular because of the adverse effects, what's their incentive or perhaps disincentives in implementing these policies? One thing that they said to us is that they have no choice because it's a national mandate. Hence, the debate now comes on how they can effectively communicate the costs of these policies to their constituents. For them, there's a reputational incentive or disincentive for implementing or not implementing these lockdowns. No? Number one, they think that implementing lockdowns may have an impact on the perception of their local governments in cooperating with national government. Given the popularity of Duterte and his weekly ramblings in his television show, local government leaders, they claim that it's important for them to follow national policies. Also, they want their constituents to see that there's doing something about COVID-19. And secondly, they think that following the national government allow them to have more access or increased social capital with the national agencies. Hence, they have access to national resources that can help them in addressing COVID-19. Thirdly, they think that prohibition measures, prohibiting physical movement and other restrictions are implemented as a blanket strategy that provides ease of implementation given uh, the lack of time to actually communicate these policies to their constituents. But again, there are also disincentives. Number one is the perception and the actual adverse impact of these lockdown policies to their constituents. And critical to this is how they're able to explain these policies or measures to their constituents. There's also seemingly perceived lack of consultation and citizen participation on how these national policies are cascaded and implemented at the local level because of time constraint and lack of mode of communication and mechanism to reach out to the important sectors. There's also this perception of lack of citizen input to make those hard policy choices more responsive to the needs of the people. And lastly, there's this notion of public trust and legitimacy. People will comply and will not complain or will criticize less about these strict lockdowns and other policy measures if they think their local leader is someone who's trustworthy, hence increasing their legitimacy. What the mayors complain about, based on my interviews with the local officials, is that most of the burden of implementation are the hands of the local governments, and they're the ones held accountable, and yet these policies are imposed to them with little consultation by the national government. Next, on the informal sector, based on our KIIs and desktop review, of course, there's unemployment and income loss, particularly those coming from the urban informal workers, such as the public utility vehicle drivers, the ambulant vendors, market vendors. There are also people who were displaced because there was a sudden and abrupt prohibition of operation of public utility vehicles, and some of the people were not able to move. There are some news documenting how these people were begging for money just to go from one place to another. There's this blaming of the poor as pasaway. Pasaway means these are citizens who are negligent, who do not follow the rules. It is as if you're poor, you're the one blaming, you are the one being blamed for the ineffective response on COVID-19 because you don't have means to actually comply with existing policies, especially those people who don't have means to have access to public transportation or private transportation because public transportation was halted. And then the checkpoints and lockdowns, curfews, there were some reports that it led to some abuses and extortion, especially with unscrupulous police officers. And there was this perceived environment of fear and securitization in policing, especially with the imposition of these lockdowns and curfews. And lastly, very importantly, is the inequitable enforcement of policies. So some of the informal sector, including the people, the vendors and the drivers, claim that the policies being implemented by local governments were not enforced predictably and equitably, with preferential treatment to those who have access to cars, to have money, to the justice system. So there are news where the elites of the country, including public officials, were exempted from strict COVID-19 measures. So how did the informal sector and the community responded to these lockdowns? Because the lockdowns resulted in unemployment and loss of income, there's been a mushrooming of efforts such as the establishment of community pantries where people can line up and get access to food. Some informal sector communities, they went protesting. They engaged in rallying, but some of the police sector in the country claim as this is politically motivated. Other other individuals or groups resorted to online financial help because Facebook and social media is a strong platform for them, especially in the Philippines where usage is very high. And then lastly, there's also volunteer and church-based support, which can be accessed by the urban poor. So as a last slide, what are the next steps of our research? We're completing the data gathering analysis for the next 3 or 4 months. But given the initial data that we have, we are interested and we'd like to probe on the following. One, there's a need to look at the citizen side perspective on lockdowns, as well as how national government perceives these policies, or the demand side perspective lockdowns and citizens. We'll also tackle deeply the intergovernmental dynamics and relations between formal actors and COVID-19 response. Perhaps in the future, after we completed our data gathering, we may explore what we call the political economy of lockdowns, including the analysis of power relations among actors. And lastly, since we're also focusing or interested in the response of the informal sector, we look at the incentives and costs of informal community-based responses. Given the costs and possible reprimand from the government, why did this sector, what allowed them to actually go out and respond to this crisis?
Again, thank you very much for your time. I'll be happy to take your comments and questions. Again, thank you very much.
Thank you for that comprehensive presentation, Jayson. So, questions from the group. I'm just looking for the... Yeah, so it was quite interesting. Yeah, there's the reaction. Yes, I was trying to look for the clap reaction. But yeah, so thank you very much for that presentation. Yeah, I was just wondering, it was so interesting how I guess the semantic, like the word, I guess the terms that have been used quite change, shifted from one concept to another. And I was just wondering what was the basis or the driving force for that, from ECQ, GCQ, then into granular lockdown, and then it became alert levels.
Because that's an interesting question, and it was talked about in the social media. Because the IATF, they seem is like a hodgepodge of people who really don't have an experience in this handling pandemics. That's what the social media people think. No? And maybe there's also internal politics inside, because there are news reports saying that the people who are focused on health are being put into the side, pushing and jockeying against those who are more of the security aspect of the pandemic. And there's also members of the IATF who are pro-business. They're thinking of really opening up the economy or limiting the damage of lockdowns the economy. So, and then I think another reason is that, of course, there's also social media and the pressure from the public. And some of the policies were deemed ineffective by some local government officials and mayors mentioned that policy guidance was not so clear, and they had to fine-tune the policies and perhaps sometimes innovate. But they also lament that they are the ones being blamed on the ground. And Duterte also blames them if they don't follow the national guidance, even though the national guidance is quite unclear. President Duterte is good at deflecting accountability to other governmental actors, actually.
Okay, so thank you very much. Are there any more questions? I just realized that we have a minute to go before we finish this session. Yes, so I guess yeah, no more questions. So I guess it's that time of the day wherein we say thank you everyone for participating in our session, day 2, at least day 2 for our special session. And I would also like to extend my gratitude and thanks to all the presenters of this session, and for sharing your very interesting and insightful presentations to all of us. And we look forward to to the progress of your research, and for the participants who were here, who stayed on and listened and asked questions. So thank you very much. And of course, for the organizers, thank you very much, Lisa, for being with us and supporting this special session. And yes, so let's give all of us a big hand of applause. And all the best for all of you. So thank you.